Detailed overview of the role of testosterone in the male reproductive system. Testosterone, the principal androgen in males, is fundamental to the development and maintenance of male reproductive functions, secondary sexual characteristics, and overall systemic health. Here's an expanded explanation. 1. Fetal development. Testosterone and male differentiation. During embryogenesis, around weeks 7 to 8 of gestation, the presence of the SRY gene on the Y chromosome initiates testicular development. Leydig cells in the developing testes secrete testosterone, which promotes the differentiation of the Wolffian ducts into internal male reproductive structures, including the epididymis, vas deferens, and seminal vesicles, is converted into dihydrotestosterone, DHT, by the enzyme 5-alpha reductase. DHT drives the development of external genitalia, penis, scrotum, and the prostate gland. Abnormalities in testosterone production. Insufficient testosterone during fetal development can lead to incomplete masculinization, resulting in conditions such as ambiguous genitalia or underdeveloped male reproductive organs. Second, puberty. Testosterone production significantly increases at the onset of puberty, primarily regulated by the hypothalamic pituitary gonadal (HPG) axis. The hypothalamus releases gonadotropin-releasing hormone, GnRH, stimulating the anterior pituitary to release luteinizing hormone, LH. LH acts on Leydig cells in the testes, triggering testosterone production. Effects of testosterone during puberty. Growth of the penis, testes, and scrotum. Initiation of spermatogenesis within the seminiferous tubules. Development of secondary sexual characteristics. Body and facial hair. Growth, increased hair on the face, chest, axillae, and pubic region. Voice deepening. Enlargement of the larynx and thickening of the vocal cords result in a deeper voice. Muscle and bone development. Testosterone increases muscle mass and bone density, contributing to the broader shoulders and more robust physique typical of males. Skin changes. Sebaceous gland activity increases, sometimes causing acne. Spermatogenesis. Testosterone is critical for the production of sperm, which occurs in the seminiferous tubules of the testes. Key roles in spermatogenesis. Testosterone acts on Sertoli cells to stimulate the process of sperm maturation, maintain the blood-testis barrier, which protects developing sperm from immune attacks, works synergistically with follicle-stimulating hormone, FSH, to support the proliferation and differentiation of spermatogonia, sperm precursor cells. Low testosterone and fertility. Reduced testosterone levels can impair spermatogenesis, leading to oligospermia, low sperm count, or azoospermia, absence of sperm. Fourth, regulation of the hypothalamic pituitary gonadal HPG axis. Testosterone plays a pivotal role in feedback regulation. High levels of testosterone inhibit the release of GnRH from the hypothalamus and LH-FSH from the anterior pituitary gland. This feedback loop ensures hormonal balance and prevents overproduction of testosterone. 5. Maintenance of male reproductive structures. Testosterone supports the health and functionality of the male reproductive organs, sustains the structure and function of the testes, prostate gland, and seminal vesicles, ensures the secretion of seminal fluids, which are vital for sperm transport and survival during ejaculation. 6. Libido and sexual function. Testosterone is essential for sexual health.
Libido, sex drive. Testosterone fuels sexual desire in men.
Erectile function. Testosterone influences nitric oxide production, a molecule critical for achieving and maintaining erections. Low testosterone levels are associated with erectile dysfunction.
7. Systemic effects of testosterone. While primarily a reproductive hormone, testosterone has systemic roles. Bone health enhances bone mineral density, reducing the risk of osteoporosis. Muscle growth increases protein synthesis, promoting muscle mass and strength. Red blood cell production stimulates erythropoiesis, red blood cell production in the bone marrow. Psychological effects regulates mood, energy levels, and cognitive function. Low testosterone can lead to fatigue, depression, and irritability. Clinical implications of testosterone dysregulation. Low testosterone hypogonadism. Causes: primary, testicular failure due to trauma, infections, e.g. mumps or chitis, or genetic disorders, e.g. Klinefelter syndrome. Secondary, pituitary or hypothalamic dysfunction, e.g., tumors, radiation therapy, or chronic illnesses. Symptoms: decreased libido and erectile dysfunction, infertility due to impaired spermatogenesis, fatigue, muscle weakness, and reduced bone density, depressed mood, and reduced cognitive function. Treatment: testosterone replacement therapy, TRT, via injections, patches, or gels. Excess testosterone causes: anabolic steroid abuse, testosterone secreting tumors, e.g., adrenal or testicular tumors. Symptoms: acne, oily skin, and excessive body hair. Aggressiveness and mood swings. Gynecomastia due to aromatization of excess testosterone into estrogen. Testicular atrophy and infertility due to suppression of the HPG axis. Testosterone is not just a cornerstone of male reproductive health, but also plays a crucial role in systemic physiology, emphasizing its importance in health and disease management.